It's okay to not be okay, and it's okay to share your feelings and reach out for help if you think you need it. This afternoon we have Peggy Myers and daughter Emily Myers with our local chapter of the American Foundation for Suicide Prevention. Peggy, we know suicide's a real issue that needs to be talked about more. I'm glad to see finally, I think coming out of COVID, the whole attitude of everyone is different because it's obvious that mental health has never been worse for Americans.
Right, for sure. And with that, just knowing that you can talk to somebody, talk saves lives, being in communication with people. And yeah, COVID was just really bad for everybody's mental health. But we're here to say that, you're not alone in your mental health struggles and that there's always somebody out there to talk to. Find somebody that you're comfortable talking to. And yeah, talk can save lives. You can talk away the dark, however you want to say it. It's just, talking to someone and having them understand or just having your feelings validated that, that's really how you think. Just because I don't feel that way doesn't mean you don't feel that way. So it's, yeah.
Emily, has it become more accepted now? Maybe beforehand, suicide wasn't really talked about, but because it's been such a prevailing thing, and the first responders, the police, the military, it's getting more coverage. There's more help for them established, but for the general public, there hasn't been. And so now people are having that conversation. Absolutely. Because it's hitting a lot of families, and maybe not the suicide, but the threat of suicide, the mental health problems.
Well, absolutely. I mean, it used to be one of those things that you'd never talked about it. If it happened, then it was lied about. It's a heart attack, or, it was a mysterious thing. Where now, we need to know how they pass so that we can stop others from doing the same and help others to feel that they're seen and that, your struggles are valid and all of that. So yeah, absolutely.
I like to read now where I read obituaries, and
I was going to ask about that.
and it's just something that I've always done.
Before that, you're sorry, they passed away suddenly,
right,
and now
right.
The family's going, you know what?
Yep.
We want to get people to understand
exactly.
This is a real problem.
And especially for the people that knew them best.
Yes.
It's like they died of complications from mental health. They died of, they lost their battle with mental health struggles. And that's huge, because then you can see that, contributions may go to the AFSP or whatever it is, or mental health services of some kind. But I mean, if you knew that person, you knew that, their struggles that they went through. So it helps to open up the conversation yet again that, mental health matters, and, the more we can get help for those people that are struggling, then, can prolong their lives or lengthen their lives.
So where were we in 2019 with suicide? Was the rate not nearly as bad as now? Hold off on, let me finish the point here.
Right.
Where were we in 2019, and then COVID hit and just took us, the whole society went haywire. There's a lot of behavioral issues and everything. Then here we are where I saw a survey, 14 of out
of 100,000
people in Ohio took their life. Wyoming has like a high of 33 per 100,000.
Right.
How bad is it now compared to what it was pre-COVID? Is COVID to blame for a lot of this?
A lot of things are to blame, but COVID didn't help. As in 2019, the AFSP had a goal to reduce suicides by 20% by 2025. And with COVID, suicides are increasing. So that just didn't, they kind of had to rearrange their way of thought. It was like, okay, we just need to get out there and, just do prevention. And, so it's more about prevention and doing what we can, getting mental health coverages increased for people. Your mental health is as important as your physical health. So you don't hesitate when you break your arm, you see it, but when it's your mental health, you don't always see it, so you don't know that people are hurting with their mental health. So it has worsened with COVID.
Emily, let's talk about children. It's an alarming rate of suicide for kids. Social media can be blamed for that. COVID can be blamed for that, for the isolation, the time lost in a classroom with their friends as they're in the formative years. Can we get out of that hole that we have right now? What can be done for children?
I mean, reminding children that they can be vocal, being that safe space for kids, and getting them back with their friends and creating that community and the connection with kids will be huge because they've lost so much of it by, having their safe space has been the internet. But that's not the human connection that they need.
Right.
That we know. It's not the same as being on a screen all the time. So if we can create that community again with children, then I feel like that can just work wonders for them.
We have a minute left. If people are watching this and go, I know someone, or maybe it's me, where can I go? Who can I talk to? What do we have?
Yeah, afsp.org has a ton of information. You can go on there. They have all kinds of information. Talk Saves Lives. They have here some self-care strategies. Self-care is huge. To be able to take care of yourself, give yourself time to recuperate, take time for yourself for meditation or whatever it is to get your mind straight. Suicide is not always just one single incident. It's a multitude of things that have happened. There's a mental health illness, some sort along the way, and then whether there's just like the straw that broke the camel's back type thing sometimes is, they just can't handle, they don't have the coping skills to handle yet one more thing. But afsp.org has a lot of information and on their website and ways of resources for help.
And we forget about the families impacted by all this. Emily and Peggy, thank you so much for coming in.
You.
We'll be right back.
Thank you.